I would like to talk briefly about culture and health and the attitudes towards health and illness in the Latino culture. A lot of that has to do with income, low income versus high income. Our socioeconomic status has a lot to do with our health. People that are on the low end of the socioeconomic status have higher mortality rates because of lack of care, while people on the higher end of the socioeconomic status have lower mortality rates because they have access to all the care that they need. These status differences aren't only limited to industrialized civilizations. The higher overall status a group has appears to provide them with enough health benefits to make up for any genetic vulnerabilities. To supplement this argument, you'll see a chart for the relation between mortality and income in the US. A lot of migrants that came to the United States from Latin America are still considered impoverished today here. This is a big variable that is relevant to health, the experience of poverty. There is research that shows poverty appears to lead to cognitive deficits that could undermine a person's decision making when it comes to healthcare. Impoverished people are more likely to be stressed while struggling to make ends meet. They tend to be more at risk for adverse health effects. Very simply put, their minds are preoccupied with the thoughts of paying their bills in the near future. Higher feelings of stress can lead to high blood pressure and even heart disease. Latinos that migrated here experience this as they work every day to try to make ends meet because they came here with nothing from their countries. Cultural beliefs also affect the healthcare they receive, especially in the Latino cultures. There are different aspects that are affected, such as how a person will seek care, who they will seek care from, how they manage self-care, how health choices are made, and how the patient responds to a specific treatment. There are barriers with Latino patients, but our healthcare and physicians can break those so they can get the care that they need. Aside from the socioeconomic status prohibiting Latinos from receiving healthcare, there are other barriers that have resulted in disparities in their quality of healthcare. Those barriers include language, no insurance, cultural beliefs, immigration status, illiteracy, and mistrust. We can break these barriers. We can push healthcare in the United States to implement culturally competent care, language services, and organizational support. Physicians must be sensitive to Latino cultural values. This will help overcome any cultural barriers and allow these people to receive the healthcare they need. Although this is a broad subject, this is all the time that I had for today. Thank you.